India has emerged as one of the fastest-growing major economies in the world and is expected to be one of the top 3 economic powers globally over the next decade. To sustain this growth, India needs a healthy population. People are engaged in upgrading themselves for a better life and work hard to achieve the national goals. In the global pharma sector, India is a significant and rising player, which supplies generic medicines accounting for 20% of the worldwide supplies. To leverage this strength of the generic medicines, Government of India had launched an initiative called Pradhan Mantri Bharatiya Janaushadhi Pariyojana, under which pharmacies have been opened up across the country to provide affordable quality medicines to its citizens. This initiative is aimed at providing high-quality generic medicines to everyone at about 50% to 90% discounted prices than the popular market brands. These generic medicines are less expensive than the branded versions, but they are identical in their therapeutic value. The government has set up pharmacies called Janaushadhi stores, where these generic medicines are made available at very reasonable price across the country. The common citizens have greatly benefited from the scheme, and this has estimated to save more than rupees 15,000 crore, $2 billion USD, of the citizens during the last 8 years. These savings belong to the people of the country, which will help them fulfill their dreams. Someone will be able to give good education to his children, and other will be able to build a home. The scheme Pradhan Mantri Bharatiya Janaushadhi Pariyojana has brought a big revolution in the
healthcare coverage of our country.
The scheme had initially been launched in the year 2008, but it was reframed under the vision of the present government for nationwide coverage and got an impetus from the government at the highest level. A franchise-like model has been put in place where the entrepreneurs, besides the commission on sale of medicines, also get small recurring incentives up to a limit for sale of medicines, and in deserving cases get one-time initial grant for setting up stores in underserved areas.
Stores kept opening, crossing 8,700 stores this year.
And in this series,
consumers also got savings of up to $2 billion simultaneously. The number of medicines and surgical instruments in Jan Aushadhi Kendras also kept increasing.
There has been a 100-fold increase in the number of stores open under the scheme in the last 8 years, and sales have also increased more than 100 times. The government of India has put in great emphasis on regulating the drug prices so as to reduce out-of-pocket healthcare expenditure, as medicines are one of the biggest components of personal spending on healthcare. It has also controlled the price of more than 1,600 medicines needed for the treatment of various diseases such as cancer, tuberculosis, diabetes, etc. The government has also ensured that the prices of stents and knee implant also remain under control. They take utmost care of quality along with reliability. An immaculate system to maintain a 2-tier quality assurance is followed in the medicines supplied under the scheme. They are procured only from WHO GMP certified companies and tested through laboratories accredited with NABL, National Accreditation Board for Testing and Calibration Laboratories. The manufacturers from whom medicines are procured under the scheme are reputed ones, and many of them export medicines to more than 100 countries. This is a testimony to their credibility. These WHO GMP certified companies take care of high-quality standards, be it procurement of raw material or production processes, packaging or final product labeling. Whenever required, Food Safety and Standards Authority of India (FSSAI) certification is obtained. High standards of prescribed temperature maintenance and quality are followed. The scheme is implemented by a society, namely Pharmaceutical and Medical Devices Bureau of India (PMBI), which has its own supply chain network. Bulk procurement is done, and economies of scale help in reducing the procurement costs. PMBI has its own huge warehouses maintained in an efficient manner. WHO GDP guidelines are followed for storage. This is also a reason that they are able to provide affordable and quality medicines. The scheme works in an advanced manner with an IT-enabled end-to-end supply chain system with point-of-sale (POS), application at store level and distribution level, which adhere to world-class standards. This is why the medicines available in Jan Aushadhi stores meet high standards, right from manufacturing to packaging, from storage to distribution, and from centers till the delivery to the customer. There are 4 warehouses located in all the 4 corners of the country: Gurugram in the north, Chennai in the south, Guwahati in the east, and Surat in the west to cover the entire country. They follow the standards of FEFO, WHO, Good Distribution Practices. SAP-based inventory management system helps in demand forecasting, and orders are placed with suppliers as per the desired inventory levels. There is a strong network of 39 distributors across India, which is capable of meeting the demand of medicines across the country.
Jan Aushadhi Sugam mobile app facilitates easy search of medicines and location search of stores on Google Map for the citizens.
Keeping in mind the public confidence and ever-increasing demand, a goal has been set to increase the number of stores under the scheme to more than 10,000 by 2024. This project has also brought about a social revolution in the country by providing environment-friendly sanitary napkins for just Rupee 1 per pad, which is about 75% cheaper than branded market products. The project has been quite successful in providing good quality medicines at 50 to 90% cheaper prices than the branded counterparts, and Jan Aushadhi as a brand has established its identity. It ensures coverage to the needy families and has garnered a lot of public support. With a little investment by government, it has facilitated estimated savings of more than $2 billion during the last 8 years, and henceforth likely to save citizens about $1 billion every year. The support at the highest level in the government for this scheme and the interaction with the beneficiaries by the Prime Minister Modi has yielded phenomenal results.
जन औषधि केंद्रों पर मिलने वाली दवाओं की कीमत बाजार में जो दवाएं मिलती हैं उसी क्वालिटी की, लेकिन जन औषधि केंद्र में 50% से 90% तक उसकी कीमत कम होती है.
Today, Jan Aushadhi stores set up under the scheme have grown tremendously in priority and are truly emerging as the solution centers for health and nutrition problems.